At INTEGRIS Health, our mission is simple: partnering with people to live healthier lives. Our vision: to be the most trusted partner for health. Every day, we work towards this by living our values: integrity, compassion, accountability, respect, and excellence. Providing excellent patient care requires caregivers ready to step into a job with purpose and opportunity for growth. From patient care techs to respiratory therapists, from lab specialists to nurses, to the people who keep our hospitals running behind the scenes, there's a role for every passion and personality. At INTEGRIS Health, we make it easy to start your journey, no matter where you are today. Our workforce development pipeline team is standing by, ready to help you find your way to the career you want and supporting you through various pipelines programs. Here's how they work. Get a feel for healthcare by shadowing a caregiver or taking a non-paid internship for a semester. You could even be introduced to healthcare by starting a job like patient care tech, no experience required. Train while you work with paid tuition for certifications like our CNA or medical assistant programs. You'll gain real-world skills in classrooms, labs, and on the floor with our caregivers. Grow your experience and skills with programs designed to help you transition into new roles, like our incredible nurse residency program, supporting nurses as they transition to full-time practice. When you're ready for more, we'll help, paying for your next steps, covering tuition for school as you advance your degree and your career growth. Now, if you're looking for a career that blends science, problem solving, and helping people, you might just find your place at an INTEGRIS Health Pharmacy. Let's explore that career path.
So as a technician, basically you can be trained at the pharmacy. So as long as you have a high school diploma, you can come into one of our locations and look to see about where you can get started. Well, we have 11 retail locations, and so we just take care of all the patients that come through the INTEGRIS system. We take care of them from top to bottom. We can do specialty drugs, we can do diabetic supplies, all your pharmaceutical needs that you need. Several locations through the metro, obviously inpatient pharmacies as well. Lots of pharmacy technician jobs at all of our different locations. Billing of prescriptions and taking care of patients, inventory management. Also, there's essentially intern jobs, so if you already are in pharmacy school, you can come into our pharmacies and work. The technicians can do everything from just filling prescriptions to also more specialized roles such as insurance adjudication and oncology, and then also working in ER, so more fast-paced environments as well. In the hospital setting, you get a lot more close patient interaction. There's just more, I would say, like bedside situations where you're not actually necessarily at your bedside, but you have to have more of a role in the patient's pharmaceutical care, and INTEGRIS allows that, which I love. I'd say another thing people don't necessarily know is the salaries are competitive. For a long time in pharmacy, it seemed like retail seemed to be the best salaries, but with INTEGRIS at least the salaries are competitive, so that's good to know for people looking to get into more of a hospital setting. And I would say there's more opportunity to get more of a broad swath of what pharmaceutical care offers, so you get a chance to see more of a variety, which I think allows you to go as far into different specialties that you may want to go into. So somebody who has a high attention to detail, somebody who has high energy, somebody who likes to stay busy. In the pharmacy world, there's always something to do. Somebody who really cares about people, because you really have to care that you're making a difference. Yeah, you learn pretty quickly. So with INTEGRIS, if you get into a role and either you like it or you're excelling and you're interested in doing other roles, because we have so many different locations, there's an ability to move to different locations. If you have to move because of your family situation or whatever, there's opportunities there. We have so many different locations and different roles. So even within the pharmacy, we have support personnel for the pharmacy. So for doing prior authorizations, which is for insurance, you can work in a department like that where you help patients who are having more of an advanced medication that requires more involvement. There's things like that as well. So definitely, because we have so many locations, there's opportunities to move up and move to other locations.